Hello everyone, thank you so much for joining us again. So another episode of Reflect and Reset with Maria and my partner in crime, Gina. So we, as you know, our mission is to really provide healthcare at an affordable price for the community, especially the uninsured community with our medical membership. Many of you have been following us now for a while. And our vision and our mission is to find ways to partner with community leaders, community partners that are also have a similar mission to really help the community and figure out a way to provide services. Like today, we are at the dental school, Touro Dental School, and Gina is going to introduce our guest.
Yeah, so Maria and I were lucky enough to make this tour about a couple months ago. And we were so impressed with this facility that we are actually filming live here at Touro Dental College. And we have Rachel Silva, who is the Director of Marketing and Outreach for the school, as well as Dr. Edward Farkas, who is the Vice Dean of Touro Dental College. So this is really exciting for us because we were blown away when we walked in here. And you have to understand, from everything that we do have some dentists on our program, but this is way beyond the services that you're going to get from a general dentistry. So maybe you can give a little explanation about what you do here.
Sure. Well, you're standing here in Touro Dental Health, which is the clinical training facility of Touro College of Dental Medicine. So the first thing people kind of assume that at Touro, a College of Dental Medicine, you actually provide dental care, and we do. We have this brand new state-of-the-art facility. Again, 81 chairs that can pretty much service all dental needs. So it's a brand new option for Westchester that hasn't really been here before.
That's unbelievable.
That is great. And we're being told that we need to raise our voice, so we are going to try to speak loud. To look at the facility and to be able to get the services at the prices that you have, that you can afford here. And you do work with Care Credit.
Care Credit, we do have a relationship with them as
Do you
well.
take insurances at all?
We take most insurances. We're working on still getting the full roster of insurances. We do take many of the Medicaid plans, and again, our prices are 20 to 50% less than you'd find in a private practice. So, I mean, a lot of procedures won't be covered anyways for insurance in terms of cosmetic procedures. So, people are looking for an affordable option. So, this is an option that you have to kind of save on very large procedures that you might not be able to afford otherwise.
Right.
And as far as the hours are concerned, are you open Monday to
So right
Friday?
now, we're Monday through Thursday, 9 to 5, and on Fridays, 9 to 3. And, you know, we can kind of step you through the process for becoming a patient here if you like.
That is
Maybe
great.
a little
That
bit.
is great.
Of course, we are, again, a dental training facility, so our goal is to educate our students. But because we have these faculty under, you know, basically in every specialty, we're able to provide services across the board. But the first important thing is coming through the door and becoming a patient. We have to screen you and make sure your medical history is clear, we know everything about you to be able to provide the right dental care for you. So that first appointment is really getting to know you, your medical history, x-rays. We have, you can talk a little about the state-of-the-art x-ray
We have
technology.
state-of-the-art three-dimensional x-rays. We also want to make sure that you're an appropriate patient for our student doctors. And then at the same time, we want to get deeply into making sure that you get the proper treatment, which means that we need to know what your expectation is and what we are able to provide for you.
And we can look at the complexity of each patient, and then we're able to pair them with the student group that is right for them. And our dentists, they work in pairs under the supervision of our faculty, of course.
And is the doctor actually there with the students as they're doing a procedure, or
Yes,
are
the
the
doctor
students
is
on their
closely,
own?
no, the students are not on their
Okay.
own. They're being closely supervised. There are parts of the procedure that the doctor has to witness.
Mhm.
Sometimes the doctor actually performs that part of the procedure. And in cases that are very complex, the doctor themselves actually do the procedure.
A lot of oral
So
surgery
patient-
cases especially.
Right, patient safety is number one priority, and, well, I should take that back. Education is the number one priority,
Right.
but at the same time, you combine that with patient safety and a learning environment that is second to none.
And the quality here is really spectacular because you just have so many eyes looking at the patient procedure. So you have 2 student dentists already providing the care. So they're able to cross-check it at different things, but you have all the faculty coming in, double-checking everything is done correctly, precisely, and you don't have that level of quality in other environments. You're also able to get a lot of opinions in one place. So I hate to say one-stop shop.
I was just
but
gonna say that.
I mean, we see it all the time where someone comes in and there are sometimes many ways to treat a patient or many different perspectives. And you're able to get all those perspectives from periodontist, a prosthodontist, an oral surgeon, all coming together to talk about the patient right then and there.
As far as braces are concerned, like, you're able to do that here?
Yes, so probably in about a week or two, we're opening up the orthodontic clinic. We have 2 expert orthodontics who themselves will be doing treatment. Orthodontics is not a student-level endeavor. It's done by people who've been doing this for many, many years. Our chief of orthodontics is Harvard-trained, and he's basically running the program and participating and making sure that these patients get both standard braces and the new Invisalign type treatments. And we also do that, we also construct the braces using our new digital dental scanners. So from top to bottom, the program is as modern as it can be.
And the discounts do apply to braces too, as well?
Yes, absolutely, and the price of the braces is actually, I think, a little bit too cheap, because.
I'm sure we would not complain.
No, I understand that, but I don't know what a set of braces in Westchester goes for, but I do know it's probably twice what we're charging.
And it is so expensive. I can tell you that we do, like Gina was saying, we work with other dentist partners, and the biggest challenge for them is they come to me because we send our members there and they don't have insurance. Even though we have insured patients, because we have many insured patients, but we are really focusing on trying to find doctors and dentists that are working with the community that doesn't have insurance. And their biggest challenge is that where do I send them for oral surgery? Where do I send them for implants? And this is the reason why, we are so dedicated in finding ways to bring, whenever we hear either our partners that work with us, the specialists, and they ask us to figure out somebody else that they need to team up with, like Touro Dental School,
Right.
to be able to do the surgeries and be able to do the implants. For us, is so important. And when we found you and we came to this facility, I mean, look guys, look at this facility. It is amazing. It's state of the art. It is extremely clean. And like you were saying, people are working as a team. I mean, I saw there's many people patients here that are being worked on. And what you find is you have a team that is working on one patient.
I mean, it's
Where do you
academic-
find that?
It's like academic medicine, right? If you go to a hospital that's affiliated with an academic provider, you're going to get better quality care. You're going to have more people around you, double checking, and all of that. So we're able to provide that here. Essentially, we are like a mini dental hospital in the middle of Westchester.
So if we send a patient in and they have whatever the issues, you have one doctor in particular with the students that consult, and then is it transparent that they need this, this, and this, and you give them the pricing, what will it cost for the whole procedure?
When somebody comes in through our intake clinic, they get assigned to a student pair. That student pair works together with a doctor that's assigned to them, possibly a surgeon. For example, if they would need implants, then they would be assigned a surgeon as well. And that team works together to make sure that the patient gets the care that they need. Not only appropriate care, but the care done in a fashion that is on time and relevant and tries not to drag out.
But they have the price before
And they have the price
services are
before. So
performed.
every patient is presented with a treatment plan that has the pricing before they
And
proceed.
the consultation, is that free?
The consultation is not free because there are x-rays that are needed to be taken to be able to diagnose the patient. We also take scans, different types of scans. But the basic idea is that the examination part of the consultation is free, but the x-rays are not.
Now, we do offer, if you have had x-rays taken within the last, 1 year, and you're able to provide those to us, and they're of the right quality, you can reduce that cost. So the initial cost could be a lot lower coming through the door. But again, the costs already are about 50% less than what we find. And we're finding actually a lot of dentists are referring to us for obviously oral surgery and procedures like that, but also for our radiograph services. We have a dental radiologist on staff. We have dental anesthesiologist on staff. We have all of these specialties actually here on premises. So,
Well, what do you think is the biggest issue with the community as far as dental hygiene? Do you find when patients come here, do you find a lot of patients that are not really doing the normal dental hygiene of, I'm obsessed with my teeth, and I go and do a cleaning 4 times every 4 months, which I think people say is every 6 months. But can you tell us what the norm is?
So the norm varies. Everybody's different. Some people are obsessed. Some people are less
Like
so.
me.
Yeah.
But the idea here is that we're here to help everybody. We're here to take care of the obsessed and not obsessed, and we're here to bring everybody into a situation that they're happy with, whatever their individual needs are. We perform very high-level cosmetic dentistry if need be.
Thank you.
We perform complete restorative dentistry. If somebody doesn't have teeth, we can put in a set of implants and teeth on top of that, and they can eat steak. And they can eat steak till they're 95, until whenever. So these are things that we're able to do now that we were never able to do before.
And is it true that you could actually see other diseases that the patient has through their teeth? So in other words, if you're checking something, you can see that the patient, let's say, has maybe heart disease or something. I know I've heard that.
there's a link between oral health and oral hygiene. And you probably can speak to that better than I'm not the dentist.
There is a link, and there are things that sometimes we do see and we refer on. But at the same time, we're able to, having the patient in the chair and being able to talk to them about their diet and about.
So, what is the best way to identify an illness through your mouth? I mean, you can get a disease if you don't have a good dental health.
So,
Like dental gum disease, I guess, is this something that actually.
right. So there are certain diseases that manifest themselves in the mouth. But the best way is by coming in for a regular checkup and cleaning and having the exam. Okay, we're able to check, the lymph nodes. We're able to check the tissues. We're able to see what's going on. We're able to understand.
medicine, even
Absolutely.
issues.
But you got to get back with it. You got to
yes.
see the dentist.
And-
every year.
Dentistry is very much like that. Small problems taken care of go away. Small problems not taken care of become very big problems.
And pediatrics we should mention too, because
Yes.
they have changed, I think, the regulations. Now they're recommending that you see the dentist by the time the first tooth comes in or the first birthday. My kids are very young, and I think it was 2 at that time. But it is
which people don't really understand.
My
Well,
sister-in-law did that with
also-
apple juice.
Sure, apple juice.
Destroyed
and
their teeth.
sodas. I mean, children in a lot of homes drink soda. It's very cheap. It's inexpensive to buy a $99
You
soda
pay in
just
Walmart.
for your whole family. You do, and I think that we're starting to, as a society, understand that better. But part of that education happens. You have the very first appointment with your doctors because they really want to be your partner in caring for your child for the long haul. So they have great teeth their whole life.
So when you say water, should they be drinking water with fluoride? I mean, should they be, because I know the bottled water doesn't have fluoride in it, right? Should they be drinking it out of the tap?
They could be drinking out of the tap. New York City, Westchester all have fluoridated water. And fluoridation has been one of the main things that we used to fight dental caries and childhood dental decay.
I don't think all counties in Westchester have fluoride.
So
though.
what would
it's
they-
important
I
to
think
check and
Westchester
see.
does.
Not
And what would
all-
they do?
Not all
Let's say they
towns
use
do.
bottled water, what would they add? What could they add into the water? Is there a
Well,
fluoride drop?
so if they're using bottled water, it really depends on, and that's the whole reason for going to the dentist, because the dentist can determine if they need a supplement or not. Most kids, if they have no dental decay and they're doing bottled water, would be fine. But on the other hand, if they do have some cavities, and sometimes you can see these cavities really early, like in 10-month-old or 12-month-old, so you know that that child is going to have problems. So we can prescribe fluoride supplements. Basically, what we would do is, there are ways of treating 10-month-old babies. Okay, it takes a lot of patience,
Yeah.
but it can be done. And but on the other hand, we hope that with proper supervision that the cavity never gets to that point.
So do 10 months olds actually have cavities?
Well,
Is it really? I mean, my son went to the dentist at 10 months because he had a lot of tartar buildup, which is kind of common. I don't know if that could
It is possible to have cavities. I've seen that before. It's not the usual way, but on the other hand, I've seen 16-month-old, 18-month.
That's not the case, right?
That's not the case. When you lose a tooth, it should be replaced. And the reason for that is, it's not like you can lose a tooth and nothing happens. What happens is that the other teeth end up taking more stress because you're missing that tooth. And eventually they become more stressed, and then they become lost. And then eventually that starts a cycle where you're missing a lot of teeth. So by replacing the tooth, the other teeth are more relaxed and are able to perform better into your old age.
And that's a they'll come for emergency visits because they've waited too long. That should be the end result. Try to get treated before that.
I personally had braces done when I actually was pregnant with Natasha,
I did
my
mine
daughter.
older too, in like,
And a lot of people, I think, have the misperception that you get your braces done when you're a kid, when you're in your teen years, and that as an adult, people might not be thinking of that.
but
And
Invisalign now too.
Sometimes.
Look at my teeth now.
We all see her teeth with her smile.
Yes, and
You should note that sometimes when we do cases, we start out one way and then we realize where the body reacts differently, and then we have to change the treatment plan. I mean, that's normal things.
I know, he's a dentist.
My
He's
stepson
been
actually
gentle.
did Invisalign. His teeth were crooked. He has the most beautiful teeth.
Who's that?
Michael, the Invisalign was perfect for him. And you know, when my daughter was going through her braces, she's 28 now, I was doing my braces with her, and I had the real
So
silver
we should
braces.
start that,
Well,
mother-daughter
listen,
braces.
Yes.
This kids still like the traditional braces. I know
Yeah.
one of our employees, her daughter loves to get the colors on her braces.
Yeah.
It just is sort of a fashion accessory. So
Yeah.
to each their own. We have both, depending on what works for you and
Uh-huh.
what you prefer.
And it's really, I think it's also, you know, what it would be the best
Right.
for the condition that you
And
have.
that's really up to the treating dentist who decides.
One thing that is, I think, very important, if you are going to get braces, because I went through the process, but you could see my teeth are still very straight, but I do the retainer at night. And I know that unfortunately my son that went through this, Franco, his teeth are, you know,
They
not
moved.
straight, they
They
moved
moved.
because he does not use the retainer. So using the retainer is something that is extremely
It's very
important.
important to follow all the instructions during, before, during, and after treatment.
They actually gave me the retainer in the back. I have the metal in the back of my teeth.
It's permanently there.
Permanent, yeah. So-
I opted not to do
Yeah,
that.
so I have it, so my teeth won't.
See, I had them as a child when I used to wear my retainer, so I should have listened to my
You're
mom. But
lucky
as an
though,
adult,
'cause
you take it more serious.
But look where you work. I think you
Exactly,
have
I was very
access
young.
to some pretty
And I was
good
gonna say, your
doctors
teeth
here.
look very white. We also do whitening here, which I know is of interest probably
Oh,
to your
yeah.
cosmetic.
I did it many years ago, and I'm still blown away how my teeth are. But I think I do go every 4 months to the dentist, and
Yeah,
I'm very big into. And I brush. So I'll ask you a question. I brush my teeth every time I eat. I told you I'm obsessed.
You're like the
with
perfect
my
dental
teeth.
patient.
I
Yeah.
hope you're using
We
a
have
soft
nothing for you
brush.
here.
I use an extra soft brush
That's fine.
because I was getting in my dentist set because I brushed so much that I needed to. That's important, the brush. So let me ask you, when should somebody use the brush that
A
is
harder
the thicker
The
one?
hard or the
Usually
medium.
recommend the medium brush
Okay.
or a soft brush if somebody's a little bit older because the enamel might be a little bit
And your
softer.
gums bleed.
Well, the gums are bleeding because they're reacting to bacteria that are there. If you
Oh, I
brush
see.
and floss consistently, there's a good chance that there will be no bleeding. I mean, that's kind of the sign. If you're not bleeding, everything's fine.
Yeah.
And even something that, because I'm the same as you, we're quick, we brush our teeth as much as we can and as fast as we can, but you just kind of brush like this instead of little round circles, which I've consciously made a decision since I've been here to do that better. I think I already feel like I'm bleeding less, just those little changes that you can make.
And you know, it's funny, my niece, I have a nephew who is almost a year and a half, and she takes lots of pictures of him, and she's like, okay, brush your teeth. And he's sitting here sucking on the toothbrush. I was like, I really hope that you're actually going to brush your teeth for him. And it's not just brush your teeth.
You
know,
gotta
he's
get
gonna
used
do
to it. And we do actually, we always do crafts for kids and we do like a little timer. You're supposed to, does anyone know how long
Right.
to brush your teeth for? It's not, we
It's-
don't
it's
all
like
do
to a
it.
song. It's,
2 minutes.
Yeah.
2
What
minutes.
was the song? Was it you that was doing the song with your daughter?
No, I mean, I have a toothbrush, electrical
That helps.
toothbrush
Yeah.
for my daughter, but my daughter is as obsessed as I am now, but I'm teaching her.
I'm shocked
I'm
by that.
teaching her the fact that taking care of your teeth is so important, so she sees I floss every day. I can't go to sleep without flossing because I don't feel clean. That's just, I floss and then I brush my teeth, and my daughter has created the same habits. I always say that we are creatures of habits, so you can create good habits or bad. So let's try to create good habits. And going to the dentist at least every 6 months, and taking care of your teeth, flossing and brushing your teeth after you eat. If you're able to do it, I would do that. How about drinking water? Does that have anything to
Water
do?
is healthy. Water is the.
It's healthy, period. Does it
Healthy,
affect
period.
your teeth or your gums?
No, but
Not to even rinse out, I don't know, mouthwash.
Oh,
Well-
mouthwash. What do you think of mouthwash? I can't use them. I feel that it's
The alcohol.
irritating.
Right.
Right, avoid alcohol.
Yeah.
You should try to avoid alcohol in the mouthwashes. What you were saying about water is really important for us for everything. And it's kind of like the perfect liquid. And so, we can't do any harm with water. and that's kind of the best way to do it. We try to get natural toothpastes and things like that, but in any case, toothpaste with fluoride can be very helpful and can help prevent cavities and tooth decay. The interesting thing that I'm going to say, what you were talking about before, was about habits. Is I've been in practice now 33 years, and there were some kids who came to me when they were 2 or 3 years old, and we taught them how to brush, or their parents taught them how to brush, and I've been following them for 30 years, and as adults they're still brushing. So this kind of habit has a place in their psyche where they end up doing it for the rest of their lives, and we're doing them a tremendous service.
Your children imitate you. I mean, we are building these little lives, and we have to take it serious. I mean, you have to live by example.
Sure.
My son always tells me, I work out. I've been working out for over 25 years, and he said, I've learned to work out through you because I saw you doing it. So we have to teaching your children from when they're little but you have to, starts with you. You have to make sure that you are taking care of your teeth and they're seeing. Do we have one more question?
What about your tongue?
What about
Your tongue.
Should
How
you
often do you should
should
clean
also,
it?
there is a brush for the tongue. It should be used when you're brushing your teeth. And what that does is the tongue is able to hold a lot of bacteria. The less bacteria you have in your mouth, the better off you are.
Can't you is it bad to use your toothbrush that you
The
use
same
for your tongue
toothbrush?
and then
It
brush your teeth?
keeps the bacteria perhaps?
You can, but there is a special, I'm just making mention, you
There
can
is
use your
one,
toothbrush,
okay.
obviously, that's what most people do.
Right.
But there is a special tongue brush if you go into the pharmacy.
And how often should someone change their toothbrush?
So you should change your toothbrush. I try to change it every month, okay, but the recommendation might be every 3 months, but at the end of 3 months.
I'll be changing it every
Right.
month.
We'll give you one before you leave.
Yeah.
Excellent.
You know.
And we're getting close to finishing the program, and this is very informative. We're very, very pleased to be here. But I want to say before we leave, tell us how many chairs do you have here? Because this is huge.
We have 81 chairs, and we're adding another.
We're adding another 28 over the summer, so by June, we'll have a total of about 109.
And that's for all specialties?
Yes.
combined.
For all
Right.
specialties, most of them are general dentists like we have here. For example, the chairs that we have here are what you would find in the very highest level private practice. This is the same
They're
cabinetry,
beautiful.
They're really comfortable,
same
like memory foam.
cabinetry,
You just
same
wanna-
chairs, same everything,
Wow.
from the finest dental manufacturers.
And again, kids, so the entire family could come here.
Well, and that's a nice thing. So we have a pediatric practice. It's a separate area for kids. But you can make your appointment, have both of your kids, all 3 of your kids seen at the same time, have grandma seen at the same time. You can do it all in one place. So we do try to make it a little
And
bit
do
more
you have an
convenient.
issue booking an appointment, or are you full, or do you have a
We
lot of
just
availability?
opened really full capacity in June, so we still have appointments available. We're not, packed at the gills. Next year we'll have another class of students coming down, so we'll be doubling our capacity in a year as well.
And I think
At
before
this
we end
point-
also, we should make sure that we take a scan,
Absolutely.
quick update.
At this point, we're seeing over 100 patients every day. And eventually, we're going to ramp up to 2, 3, or maybe 400 patients.
That's great, that's great.
That is
And
excellent.
I will mention just in closing, we do have a lot of other community outreach programs that we'll certainly be happy to share with you guys. So we're having, for example, a veterans screening program. We're offering free dental care to veterans, screenings, cleanings, on a special day only, which is the 8th of November. And we're inviting veterans, military, and their families to come in for free. We'd love to put that out. And we also do the same for kids in February. So we have a lot of
We
events.
definitely want all of that information because
And we'll
we are
post it.
all about giving the community the information that they don't get to know, right? Because I did not know that you guys were here. And when Gina and I came here,
I met you at one of the events, the networking events, and then we hooked up
Yeah.
to get an appointment.
and
then so we are.
we're extremely excited, which is our favorite word.
Yes.
We're always very excited about making a difference, and that's how we feel. What we've done today, we've done our job. Would you say,
Absolutely,
partner?
absolutely.
We've done our job. We are taking care of you as much as possible, and we want to thank you again for allowing us to come to you and taking the time to watch us on Facebook Live, and we thank you from the bottom of our hearts. Please like our Facebook page and
And Touro Dental College as well.
yes,
And we're gonna also take some stills, so look on the Facebook, and you'll see some stills of the facility.
thank you so much.
Take care.
Bye.
Thanks for
Thank you
having
guys. Take care.
Thank you.